Now please see, please check, please
Trial
confirm.
version.
Is it okay now? Done certain changes in the app. Please confirm it
Trial
is fine.
version.
Then we'll be starting.
Trial version. Trial version.
खोला तो है, check करो.
Trial version.
Audible. So yeah, thank you
Trial
so much
version.
for confirmation. So hi guys, good evening everyone. I'm Vijay. I am faculty of orthopedics at DBMCI.
Trial version.
And with so many messages from the season 1, and when I put this poster on Facebook, on our DBMCI
Trial
group, on my
version.
group, so many messages received again personally on these WhatsApp and Telegram. So those who are having
Trial
my
version.
number, well and good, I got the personal messages. Those who are not having the number got the message on Telegram. So thank you so much for all your
Trial
messages.
version.
And today we are starting with the season 2 of clinical case discussion in orthopedics. Okay?
Trial
Like we
version.
did in season 1, we discussed almost, I guess, some 10 to 13, 12, 13 cases in season 1.
Trial
So today
version.
also we are starting with a case. It is a very, very interesting case, and it won't finish because we already lost some
Trial
20,
version.
25 minutes today. So I'll be taking some half an hour session, half an hour, 40-minute session today, in which I'll be
Trial
discussing
version.
with you one very interesting case that I received in this January only. Okay, so I hope we are good to go now.
Trial
So
version.
if it is fine, please do confirm that I start showing you certain
Trial version.
PPT images, the videos. Okay, so I start with this. I'll be just starting with
Trial
this. So
version.
are we good to go? Are we ready to start? So this is Orthonext series, season 2, the first case of this
Trial
series.
version.
So we are starting today, and yeah, if it is fine,
Trial version.
if it is fine, then I'm just ready to start.
Trial version. Trial version.
Please do confirm that I start showing you certain
Trial version.
PPT images, the videos. Okay, so I start with this.
Trial version.
Just starting with this. So are we good to go? Are we ready to start? So this is also next series.
Trial version.
So we are starting today, and okay, so certain confirmation
Trial
if I can
version.
get, that will be better. If it is fine, then yeah, thank you. Thank you so
Trial
much.
version.
Okay, so the case today we are going to discuss is a,
Trial version.
I don't know, something in between is saying trial version again and again. I don't know why
Trial
it is
version.
there. So now the case we are going to discuss today is some Mr. Ram Babu. I have changed the name
Trial
intentionally.
version.
Age is correct. It is a 59 years old male. I don't know in between what is
Trial
causing
version.
this trial version to come again and again. Please ignore that sound. I have connected a
Trial
mobile
version.
phone with my laptop to show you the screen so that I can interact with you. I forgot to bring my webcam today, so please ignore
Trial
that for the
version.
day. So there is a patient known as Ram Babu. His age is 59.
Trial version.
He presented to me in the month of January only, and his complaints were that he is
Trial
unable
version.
to bear weight on his right lower limb for some 5 to 6 years. Okay, unable to bear weight. Second, he is having
Trial
continuous
version.
discharge from the right lower thigh lateral aspect. Now, what do
Trial
these
version.
two points tell you? He is unable to bear weight. That means either there is a failure of power,
Trial
or
version.
probably the bones are not united. Only two things can happen. Either problem, we are standing on basically two pillars.
Trial version.
One is the muscle bulk and another is
Trial
the
version.
bone. So there are only two reasons why a patient cannot bear weight on his lower limbs. One, there is problem with the
Trial
bones.
version.
The bones are not in continuity. That means there is some fracture, there is some non-union, something else, or some problem with
Trial
the muscle.
version.
So muscle can have what problem? The muscle can have a problem of paralysis, right? So Either it is a
Trial
neurological
version.
condition or it is a bony problem. Either of the two, right? So I'm just showing you when this patient presented to
Trial
me.
version.
Then what was the clinical scenario? To my hospital. When he came to the hospital, his
Trial
presentation
version.
was something like this. Have a look on the video. Have a look on the video. I forgot to bring the original
Trial
video
version.
that we have clicked by mobile. So I'm using the CCTV footage. See how the patient is coming in the
Trial
hospital.
version.
This is the presentation of the patient. That is how he's coming to us. See, the one walking with the calipers.
Trial version.
The one walking with the calipers is the patient, right? So basically the purpose of showing you this video
Trial
is
version.
just the two important things what he told me. He told me he's unable to bear weight on his right lower limb. Right? So this is the
Trial
patient
version.
who is coming to you. In the helmet you can see the attendant who is trying to assist him to lie on the bed. So this
Trial
is the patient.
version.
Okay? So patient has come to me with complaint of not being able to bear weight and continuous
Trial
discharge.
version.
Now these two lines, what do they tell you? These two lines, they tell me if there is a discharge from any of the site, any of the
Trial
bone.
version.
What does it tell me? It gives me only one important hint. Discharge obviously is of what?
Trial
If there is a
version.
discharge, it would be of definitely pus. So he's having a discharge for last some 5 to 6 years.
Trial
So
version.
I'll give you some more details. Right, there is a discharge. He said there is a discharge. When I evaluated him clinically,
Trial
I found three
version.
important things. One, discharge from the right lower thigh from the lateral aspect, which was something like this.
Trial version.
All of you easily these were where he was having a discharge. Okay. Second problem was what
Trial
I
version.
evaluated in the patient was that he was having a knee flexion deformity of almost 20 degrees. That you can evaluate in this particular case.
Trial version.
Right, in the image. And third, I would appreciate in the patient was there is a shortening of
Trial version.
shortening of the right lower limb. Have a look on this. So this limb, left side is lengthier, it is longer,
Trial version.
and the right side is shorter as compared to the left side. So patient came and I evaluated these
Trial
three things.
version.
Patient came walking with the help of calipers, not able to put the weight on the right side. Complain of
Trial
discharge from the
version.
right lower thigh lateral aspect. When I evaluated, these are the three findings I could
Trial
see
version.
when I inspected him for the first time. Okay, so I think it is pretty much clear. The three things I have.
Trial version.
When I asked the patient what was the history, what is the past history, how did it all started, that is a very, very important thing when you are talking
Trial
to a
version.
patient. When you are discussing with the patient, this is very, very important. So the patient told me that he had a road traffic accident
Trial version.
when in 2016. So in January somewhere, end of 15 and in
Trial version.
of 16, traffic accident, and post road traffic accident, he was operated at some hospital
Trial
in a
version.
state for two important fractures. One was fracture femur and other was fracture tibia. He was
Trial
operated
version.
for two injuries. Right? He was operated for two injuries. After some time of his surgery,
Trial
he
version.
developed discharging sinus around 2 months post surgery. So after being operated, around after 2 months of surgery,
Trial
he
version.
developed what? He developed discharging sinuses. Right? So what was that suggestive of? It
Trial
was suggestive
version.
that he has already developed some sort of infection in the bones. And since then, he has been operated
Trial
multiple
version.
times but not relieved of his symptoms. I think this much of history
Trial
is
version.
enough to tell us that what is the diagnosis of the patient. What is the patient? What exactly is the disease,
Trial
the
version.
illness the patient is suffering from? Can you please tell me? Can you please tell me what was the diagnosis?
Trial version.
What do you think was the diagnosis of this particular patient? If you can, please let me know. And I am moving on to the next slide. So I am
Trial
waiting for
version.
your messages on the chat box. What do you think is the disease the patient is suffering from?
Trial version.
He had an injury. He had an accident when 2016, and now he is presenting with shortening,
Trial version.
in their weight, sinus discharge. So what he has already developed, this infection, what will you call it? Okay.
Trial
so
version.
now in the personal history, one important point was highlighted. What was that point? There was no comorbid
Trial
situation. There is
version.
no diabetes. There is no hypertension. Nothing. Absolutely nothing. But he is a chronic smoker.
Trial
He's a
version.
chronic smoker for last 25 years. Almost one bundle per day. That is what he told me.
Trial
Sir,
version.
I smoked almost one bundle per day. now he's not. For almost for
Trial
25
version.
to 30 years, I have been smoking one bundle per day of BD. So what does that tell you? Chronic smoker.
Trial version.
That means somewhere immunity is compromised. Somewhere there is a high possibility. Somewhere there is a high probability
Trial
that the bone
version.
has not united. Right? So now when I have
Trial
already
version.
asked you the question. What is the diagnosis? So depending on the clinical features that I've seen, if I say
Trial version.
what should be our primary diagnosis? What should be our primary diagnosis? Now, if this is a case in my
Trial version.
if this is a university exam, what should be my diagnosis? If this is a case
Trial
in my
version.
OPD, then what should be my diagnosis? Okay, so what should be my primary diagnosis? CAVA has already
Trial
answered
version.
it that it should be chronic osteomyelitis. But I have shown you three important images.
Trial version.
I have shown you certain three important these images. No, one image with sinus, one image with and one image with
Trial
shortening.
version.
Right? So primary diagnosis while looking at the patient should be
Trial version.
6 years old, 6 years or 5 years old, chronic
Trial version.
osteomyelitis, isn't it? 6 years old, chronic
Trial
osteomyelitis
version.
with
Trial version.
flexion deformity,
Trial version.
of right knee, with flexion deformity of
Trial version.
right knee, shortening, with shortening
Trial
of
version.
right leg. Okay,
Trial
so 6 years
version.
old, chronic osteomyelitis with flexion deformity of right knee, with
Trial
shortening of
version.
right leg. This is my primary diagnosis. I have just
Trial
evaluated
version.
him clinically. So this is just my clinical evaluation. I
Trial
have just
version.
evaluated him, and this is what I have reached to on preliminary diagnosis.
Trial
Right now,
version.
I have not done any kind of investigations. Right? So 6 years
Trial
old
version.
chronic osteomyelitis with flexion deformity of right knee, or you can write down here
Trial
6
version.
years old chronic osteomyelitis of right femur.
Trial version.
With flexion deformity of the right knee with shortening of the leg. Okay. So
Trial version.
now what should be my next step? What should be clinical evaluation?
Trial
Now what should I
version.
do? I know there is a sinus discharge. I know there is a flexion deformity. I know
Trial
there is
version.
shortening, and I know he is a smoker and he has been operated some 5 to 6 years back.
Trial version.
So what should be my next step after the clinical evaluation? So whenever such kind of patient presents to
Trial
us,
version.
my next step would be to evaluate, get the investigations done.
Trial version.
Now I can get two things done. One, I can get blood evaluation done.
Trial version.
I can get blood evaluation done, and I can get radiological evaluation done.
Trial
Blood
version.
and radiological evaluation done. In the blood, what
Trial
I want
version.
to see. In the blood, what I want to see. In the blood, I want to see the infectivity,
Trial
infection
version.
rate, how much infection, and what all in the blood can tell me the infection.
Trial
The TLC
version.
count, isn't it? The ESR, the CRP.
Trial
So
version.
all the three can tell me about the infection in the blood, right?
Trial
What
version.
about the radiology? What about the radiology? First thing, obviously, in the radiology
Trial
I'll done
version.
is X-rays, isn't it? First thing I'll get done
Trial
in
version.
the radiology, X-rays. So when I
Trial
got
version.
the X-ray of this patient done, it was something like this. It was something
Trial
like this.
version.
Now, can you describe this X-ray? Do you know what these all
Trial
structures
version.
are? Try this. I am just labeling it, and now try to label all the
Trial
things
version.
that I am marking. So all of you can see that the lower femur
Trial version.
is still showing us a gap, a big gap in between. Lower femur
Trial
is
version.
still showing us a big gap in between, right? And there are certain beaded
Trial version.
these structures are there, and there is a big implant. The plate is
Trial
here with
version.
the multiple screws which has been fixed in the femur. Okay, so if I just want to label
Trial
them,
version.
what are these structures? Beaded appearance. What are these? Number one, I'm labeling them as
Trial version.
okay. So implant I label as number one, screws as number
Trial
two.
version.
What is this number three? Can you tell me this? What is this number three? And obviously
Trial
number
version.
four, you all can see that it is non the bone has yet not
Trial
united.
version.
Right? The bone has yet not united. So this was the X-ray of this
Trial
particular
version.
patient that we had with us. Okay, so non-union, what is that number
Trial
3?
version.
Number 2 is screw, number 1 is plate. So non-union site is very well appreciable.
Trial version.
It is very well seen at this area. It is very well seen
Trial
at this
version.
area. Again, I have written over here number 1 in blue. Okay, so number 1
Trial version.
implant. Number 1 is this. This is a plate.
Trial
Number
version.
2 is the screw. These you see here. All these, can you see this here? These are
Trial
what?
version.
These are cements. These are cemented beads.
Trial
These are known
version.
as cemented beads. So these are all cemented
Trial
beads.
version.
There is so much to learn from this one case. These are
Trial
cemented
version.
antibiotic beads. These are
Trial version.
cemented antibiotic beads. So all of you know that which is the most common
Trial
cement
version.
used in orthopedics? It is PMMA. So what we do with that PMMA?
Trial version.
We mix the antibiotic, we make some small balls, and then that
Trial
ball
version.
is placed in an infective area, so that the antibiotic is liberated
Trial
slowly
version.
and gradually, and it helps in healing the infection. Okay, so 3
Trial
is
version.
sequestrum. No, 3 is not sequestrum. Nishita.
Trial version.
Nishtha. This is not sequestrum. These are antibiotic beads. I just
Trial version.
Okay, so this is actually a case of chronic osteomyelitis. And now after looking at this
Trial
X-ray,
version.
what is my diagnosis? What should be my final diagnosis? Looking at this
Trial
particular
version.
X-ray, my final diagnosis for this particular case should be
Trial
my
version.
final diagnosis, which I mentioned in the documents of the patient. The
Trial
final
version.
diagnosis of this particular patient, which I mentioned, was that
Trial version.
it is a 6 years old. It is a 6 year old
Trial version.
non-union. It is a 6 years old
Trial
non-union
version.
with chronic osteomyelitis.
Trial
It is
version.
a 6 years old non-union with chronic osteomyelitis of right
Trial version.
lower femur, with
Trial version.
sinus, because the sinus I have already shown you from where the pus was coming out,
Trial
with sinus
version.
discharge, with
Trial version.
flexion deformity of the knee, flexion deformity
Trial
of
version.
right deformity of right
Trial
knee,
version.
with shortening of the right leg,
Trial
with
version.
shortening of right leg,
Trial
with
version.
shortening of the right leg, with implant in situ. The implant is inside.
Trial version.
That has become such a big long diagnosis, isn't it?
Trial
So we have
version.
incorporated every word in our diagnosis. We have incorporated every word in our
Trial
diagnosis.
version.
That how much old? 6 years old. Union or non-union? Non-union.
Trial version.
Is it infective? Yes, it's a chronic osteomyelitis of right lower femur.
Trial
So there are
version.
so many things to be learned from here with the antibiotic impregnated beads
Trial
inside.
version.
Right? These are so many things that you can very well learn from this particular case.
Trial version.
So the purpose of showing you this case was to have a discussion on chronic osteomyelitis.
Trial
How it
version.
started, how it has settled inside the bone, and how it is going to affect the patient, what
Trial
kind of
version.
management you can plan for it. So there are so many troubles we have to take care of this in this particular
Trial
patient.
version.
What are the different problems? One, the bone has not united. Second problem is there is infection.
Trial version.
We have to remove the infection. We have to try to remove the infection. Number 3, there is
Trial
shortening.
version.
Number 4, the knee is having a flexion deformity. Right? So these
Trial
are
version.
4 major problems that I have to address now in this particular patient.
Trial version.
How we proceed? We can proceed with or after
Trial version.
learning something about chronic osteomyelitis. Okay, so what exactly is chronic osteomyelitis
version.
now? What is a hallmark for chronic osteomyelitis now? The hallmark for chronic osteomyelitis, you all know,
Trial
is a
version.
dead bone which is surrounded by granulation tissue. So where is a dead bone? This dead bone
Trial
is here.
version.
This is all the dead bone. All area of the dead bone. These are
Trial
the reasons
version.
why some of the patient or some patient is having a discharge from the skin. Right?
Trial
So these
version.
are antibiotic beads. This is all the dead bone. This is sequestrum.
Trial version.
So this is our diagnosis. So now when we have come to a conclusion,
Trial
this
version.
patient who has come to me from a long distance now is having this particular diagnosis.
Trial
Okay,
version.
so let's discuss the point 1. In our case, that is
Trial
chronic
version.
osteomyelitis or simply the osteomyelitis. So point I want to discuss with you here
Trial version.
is osteomyelitis. So we can discuss a bit
Trial
about
version.
osteomyelitis. So you all know that what is osteomyelitis?
Trial
You
version.
all know that what is osteomyelitis? Itis is inflammation, osteo is bone,
Trial version.
mylia is marrow. So infection of the bone and the marrow is what you call
Trial version.
osteomyelitis. Right? Broadly, osteomyelitis, see, there are various ways to classify
Trial
osteomyelitis.
version.
There are multiple ways to
Trial version.
like acute, subacute, or chronic, or it can be divided
Trial
as
version.
pyogenic or non-pyogenic, like that. So there are various ways in which we can describe
version.
or classify the osteomyelitis. Okay, so
Trial
osteomyelitis,
version.
it can be like this. Osteomyelitis
Trial
can
version.
be acute, it can be acute,
Trial version.
subacute, or
Trial
chronic.
version.
Acute, subacute, or
Trial
chronic.
version.
Or it can be classified simply as pyogenic
Trial version.
or non-pyogenic. Pyogenic or
Trial version.
non-pyogenic. You all know that the Gary's osteomyelitis.
Trial version.
Remember that osteomyelitis? We will discuss that. So osteomyelitis can be acute, subacute, or chronic.
Trial version.
Right? Subacute variant of osteomyelitis,
Trial
the
version.
localized form, is what you call Brody's abscess. Is what you call
Trial version.
Brody's abscess. Chronic osteomyelitis, a variant of chronic osteomyelitis, is what we
Trial
call
version.
the sclerosing osteomyelitis
Trial
of Gary.
version.
Sclerosing osteomyelitis of Gary.
Trial version.
And one additional entity that we can discuss while discussing this
Trial
particular
version.
case, it is the chronic
Trial version.
chronic multifocal osteomyelitis. Chronic
Trial version.
multifocal osteomyelitis. Chronic multifocal
Trial version.
osteomyelitis. Okay, so acute osteomyelitis, subacute osteomyelitis, chronic osteomyelitis,
version.
Brody's, sclerosing osteomyelitis of Gary, or the chronic osteomyelitis, chronic
Trial version.
multifocal osteomyelitis. Right? These are the different types of osteomyelitis.
Trial
This
version.
is read as CRMO, chronic multifocal osteomyelitis.
Trial version.
These are different types of osteomyelitis. Okay, so one
Trial
by one
version.
we can discuss about all these osteomyelitis, the important points, important facts about all the
Trial version.
osteomyelitis. Right? This is broadly what we have discussed right now. That is a broad
Trial version.
interpretation. That is a broad interpretation that we should remember. So chronic
Trial version.
multifocal osteomyelitis is one, acute is one, subacute is one, chronic is another one.
Trial
Okay,
version.
pyogenic and non-pyogenic are a kind of these different osteomyelitis only. Okay, so let's
Trial
discuss
version.
these osteomyelitis one by one. We know that the osteomyelitis, what exactly is the
version.
meaning of acute osteomyelitis? What exactly is the meaning of acute
Trial version.
osteomyelitis? See, if you talk about the duration,
Trial version.
it is not mandatorily that it is
Trial
less
version.
than 6 weeks only, and after 6 weeks you call it chronic osteomyelitis. Yes, majority of the literature
Trial
it divides
version.
acute and chronic osteomyelitis by the gap of 6 weeks or more than 6 weeks.
Trial
Okay.
version.
So acute osteomyelitis, you all know that the most common for acute,
Trial
first of all,
version.
why it occurs. So acute osteomyelitis can be because of two reasons.
Trial version.
One, it can be hematogenous. Why it will be there? It will be
Trial version.
hematogenous. Or why it can be there? It can be
Trial version.
hematogenous. Or number two, it can be from
Trial
some
version.
other region that we call as exogenous, coming from outside.
Trial version.
Right? Coming from outside means like after open fracture,
Trial version.
after some surgery, like iatrogenic, surgeon has introduced the
Trial
infection,
version.
or spread from adjacent tissue.
Trial version.
Spread from adjacent tissue.
Trial version.
Right? We know that the most commonest reason or more commonest reason is
Trial version.
the hematogenous route. Right? Now this acute
Trial
osteomyelitis,
version.
it is more common. It is more common
Trial version.
at the metaphyseal area, and we know the reason why it is common
Trial
at the
version.
metaphyseal area, because because the blood supply at the area, if I draw a bone like this, the blood supply will be in the loop arrangement, and because of the loop arrangement, you know that the infection is being carried in blood, hematogenous route. So when the blood supply has to slow down, it will slow down and it will stabilize itself into the metaphyseal area. Therefore, metaphysis is the most commonest site for acute osteomyelitis, right? It is more common, acute osteomyelitis we have seen, it is more common in male patients. Okay, so the most common site, sometimes the site, when they ask you the commonest site, so in children and in young patient, basically in children and in young patients, the most common site for acute osteomyelitis, it is hip joint. It is hip joint. But when they ask about the site, most common site in adult, when they ask about the most common site in the adult, then it is vertebra. So most common site in adult will be vertebra. In the children's, in the young patients, it will be hip joint. Okay, so that is the most commonest site. Now, basically the hip joint is more commonly involved because they are more common wherever the joint area is the intra-articular area, it is inside the capsule. Basically the affection occurs inside the joint areas. Okay, so more common the intra-articular regions, the metaphyseal area is around the capsule area, intra-articular areas. So hip, other than hip, which joints are more commonly affected by osteomyelitis? They are, one is proximal humerus. One is proximal humerus. Okay. Number two, the radial neck. Number two, the radial neck. Distal fibula. The distal fibula. These are the common areas which have a high tendency to undergo osteomyelitis. Right? So metaphyseal area is more commonly involved, and these are the common sites which are involved in osteomyelitis. Now, how do I make a diagnosis? How do I make a diagnosis? How will the patient be presenting? Diagnosis can be easily made by the patient will be presenting to you with certain complaints, the history, the pain, swelling, fever, like that, and obviously the clinical evaluation, local rise of temperature, tenderness, inability to move the joint. So history and clinical evaluation helps a lot, right? Second, as we discussed, the blood parameters, the ESR and CRP. So I got it done in the patient. I got done ESR and CRP. So they were raised, and we know that, and we should actually know that CRP is always a better marker to tell you about the acute infection. CRP is always a better marker to tell you about the infection. Okay, so ESR and CRP. Now, what I got next done in any case of osteomyelitis will be X-ray. How the X-ray will be helpful? X-ray is helpful in the way that it can show me infection from first to third day. What it can show me? From first to third day, it can show me soft tissue swelling. From first to third day, it can show me soft tissue swelling. Okay, but the specific bony changes, the changes will take how much? The specific bony changes takes around 10 to 12 days to appear on X-ray, and these two are your MCQs for your PGME also. What is the earliest sign of osteomyelitis on X-ray? So it is soft tissue edema, it is soft tissue swelling. But when they ask you about the specific changes on X-rays which are seen, they will be seen on how many days? Around 2 weeks, 10 to 12 days. Okay, approximately 10 to 12 days. What next we can get done? We can get done the MRI. Right? It can show you marrow edema. It is having a very high sensitivity, approximately 90%. Okay. I got to tell you about the infection. And then we can have the technetium 99 scans. Although the scans they are having a basically the onset with they can take 24 to 48 hours. The scans can check the possibility of infection within first 24 to 48 hours, but point is we are not getting it done because we have got an MRI which easily can catch a probability of having an infection. It is highly sensitive, as I said, 98% approximately. Okay, and sometimes we can use the ultrasound also to differentiate acute osteomyelitis from differential conditions like USG can
Trial version.
osteomyelitis with multiple other conditions. What are those conditions? Like soft tissue.
Trial
Like we can
version.
have a patient with cellulitis. Okay, patient may have the soft
Trial
tissue
version.
abscess. So these can help us out.
Trial
These can
version.
help us out, or simply the joint infection like acute septic arthritis.
Trial version.
So these are differential diagnoses in which who can help us? Ultrasound.
Trial version.
So patient came to me with pain, source of infection I know, the root of infection I know, so site I know, so all the possibilities I already know. Okay.
Trial
Now point
version.
is I do need to treat the patient. How do I treat this patient now? What should be the
Trial
treatment
version.
now? Treatment for this patient would be
Trial version.
so let's treat this patient. How would I treat it?
Trial version.
Treatment will be based on antibiotics.
Trial version.
Treatment will be based on antibiotics. But question comes, which
Trial
antibiotics
version.
to be used? So we have discussed so many investigations, but do remember always,
Trial version.
the gold standard
Trial version.
to diagnose a infection, the gold standard to diagnose the
Trial
infection,
version.
it is always a culture and sensitivity.
Trial version.
And how do we get the culture? It can be a biopsy material, it can be an aspirate, anything.
Trial
So
version.
gold standard is always the culture and sensitivity. It is always aspiration.
Trial version.
It is always aspiration or biopsy.
Trial version.
So send it for culture and sensitivity. So now this culture and sensitivity is going to tell me
Trial
that which
version.
antibiotics should I use. So antibiotics should be dependent on culture and sensitivity.
Trial version.
Antibiotics should be dependent on culture and sensitivity. Okay.
Trial
Plus minus
version.
surgery if required. Plus minus surgery.
Trial version.
So plus minus surgery. So antibiotics, culture sensitivity, plus minus surgery.
Trial version.
So always remember for your PG purpose also, PGME purpose also, if they ever ask you what is the best way to
Trial
diagnose
version.
the infection, the best way to diagnose the infection is by culture and sensitivity, and that too by
Trial version.
aspirin or biopsy. Okay, this is acute osteomyelitis.
Trial version.
This is acute osteomyelitis. So we know that my patient, the patient we are
Trial
having
version.
the discussion about, is not having acute osteomyelitis. He is having chronic osteomyelitis. So we should
Trial version.
know exactly what is the meaning of other two osteomyelitis.
Trial version.
Apologies for today. We lost almost half an
Trial
hour
version.
and we have taken this 20-25 minute session today. I have started the case. I'll be taking this
Trial
case
version.
and very soon. So I'm just providing my mail ID to all of you
Trial
so that you
version.
can provide your inputs to me about these cases. Today was the first case, and because of YouTube
Trial
policies,
version.
we have not been able to start on time. We were trying from 9:40, but
Trial version.
somehow YouTube was not allowing the live feed. Okay, so that's the mail
Trial
ID on which you
version.
can provide me the feedbacks, or I am providing you the WhatsApp number also.
Trial version.
You can also try to just cover up, complete this case in 1 hour.
Trial
Okay,
version.
so I'll be seeing you on next Thursday again. I'll try
Trial
to
version.
make this session twice a week. That is up to you. Just one question from you is, shall we
Trial
have this
version.
session on Thursdays only? Shall we have these sessions on Thursdays only?
Trial version.
Or twice a week? So we can plan some day.
Trial
We can
version.
go for twice a week or Thursday only if you want. So please do provide me your feedback.
Trial version.
So accordingly, I will plan. Okay, so today's session somehow got
Trial version.
disturbed because of technical glitches. But yes, next time we'll
Trial
try.
version.
I'll try to show you all the videos, all the clinical images, what we did, and what exactly should be
Trial
done in
version.
these kind of cases. Okay, so I'll be seeing you all next week, Thursday.
Trial version.
But if you can provide me the feedback once or twice a week, that will be kind of you, and we'll be going accordingly.
Trial version.
Okay, so apologies again for today. Thank you so much for the day, and see you
Trial
all
version.
next Thursday.
Trial version. Trial version.